Sis, welcome back to the Reena Malik. I'm your host, Dr. Reena Malik, urologist and pelvic surgeon. Today, we're going to talk all about erections and erectile dysfunction. We'll begin with understanding how the body works, what causes erectile dysfunction, whether pornography plays a role, and how to prevent or even reverse it. We'll also look at how exercise, diet, and lifestyle impact erections. Your penis is made up of two spongy bodies called the corpora cavernosa. These are the main erectile tissues, each containing a large artery that brings in blood flow and surrounded by veins that carry blood away. These tissues are enclosed in a tough, elastic sheath called the tunica albuginea, which has both circular and longitudinal layers made of strong type 1 collagen, almost as strong as steel. When the spongy bodies fill with blood during arousal, the tunica stretches and compresses the veins, trapping blood inside and making the erection firm. When you become aroused, whether from touch, sight, sound, or thought, signals travel from the brain's hypothalamus down the spinal cord to the nerves in the penis. These nerves release neurotransmitters like nitric oxide, which acts as the ignition switch for erections. Nitric oxide relaxes the muscles in the corpora, allowing several times more blood to flow in and fill the penis. As pressure builds, veins are compressed, preventing blood from leaving, and a reflex at the base of the penis causes the muscles there to contract, making the erection even firmer. When the penis is flaccid, oxygen levels in the tissues are about 20 to 40 mmHg, but during an erection that jumps to 90 to 100 mmHg. The penis actually extends deep into the pelvis, curving downward, which is why stimulation of the perineum can feel pleasurable. It's still part of the erectile tissue. There are three main types of erections: reflexive, psychogenic, and nocturnal. Reflexive erections are caused by direct physical stimulation and don't rely on conscious control. Psychogenic erections are triggered by mental, visual, or emotional stimulation. Nocturnal erections happen during sleep, especially during REM, and most men experience 3 to 5 of them every night. Waking up with an erection, often called morning wood, is a healthy sign of good blood flow, nerve function, and hormone balance. If you experience strong morning erections but difficulty during the day, that often points to psychological rather than physical causes. Psychological or psychogenic erectile dysfunction is very common. Even when there's a physical issue, since the anxiety and frustration that come with erectile difficulties can make things worse. This creates a cycle of stress and performance anxiety. Worrying about getting or maintaining an erection can actually prevent one from happening. So performance anxiety, relationship issues, guilt, low self-esteem, and even cultural or religious pressures can contribute to psychological erectile dysfunction. Past trauma, depression, or stress can also affect performance. Treatments often include cognitive behavioral therapy, sensate focus exercises, or short-term use of medications like sildenafil or tadalafil to help rebuild confidence. One of the most common physical causes of ED is vascular dysfunction. Erections depend on nitric oxide production and healthy blood vessels. Conditions like high blood pressure, high cholesterol, heart disease, and diabetes can damage the arteries, reducing blood flow to the penis. When blood doesn't flow properly, oxygen levels drop, and over time, scar tissue can develop in the erectile tissue, making it less elastic and responsive. Sometimes the problem is that blood flows in but leaks out too quickly, a condition known as venous leak. This can happen when the tunica albuginea doesn't expand enough to compress the veins properly, allowing blood to drain before a firm erection can be maintained. Neurologic disorders, pelvic surgeries, or Peyronie's disease can also cause this. Diabetes is a major contributor to erectile dysfunction. Men with diabetes are about 3.5 times more likely to have ED, and nearly half will experience it at some point. Certain medications can also cause problems. Antidepressants like Zoloft, anti-anxiety drugs such as Valium, antihistamines like Benadryl, and even some blood pressure medications can contribute. Diuretics and beta blockers are among the most common culprits. If you're taking these, talk to your doctor about alternatives. Other medications like chemotherapy drugs, Parkinson's treatments, painkillers, And recreational drugs can also interfere with erections. Neurologic causes include spinal cord injuries, multiple sclerosis, or nerve damage from pelvic surgery. Hormonal causes are less common, but low testosterone, thyroid imbalances, or high prolactin levels can all play a role. Smoking is another major cause. It damages blood vessels and nerves, and over time, it can even reduce penis size due to loss of elasticity in the tissues. The good news is that quitting smoking, especially when you're young, can reverse much of that damage and restore normal function. Alcohol and recreational drugs can also affect erections. Heavy drinking can temporarily impair performance, what's sometimes called whiskey dick. Chronic use lowers testosterone, damages nerves, and leads to long-term dysfunction. Amphetamines, opioids, ecstasy, and chronic cannabis use can also disrupt the body's hormonal and vascular systems, reducing erectile function. Erectile dysfunction isn't just a sexual health issue. It's often an early warning sign of heart disease. The arteries in the penis are smaller than those in the heart, so blockages often appear there first. If you have ED, it's important to check your blood sugar, cholesterol, and heart function. Studies show that within 7 years of developing ED, about 15% of men will experience a heart attack. There's also a connection between erectile and brain health. Poor blood flow affects both, and men with ED have been found to be more likely to develop cognitive decline or dementia over time. Now to the big question, does pornography cause erectile dysfunction? Studies show no direct link between porn use and ED. However, in men with anxiety, depression, or guilt about using porn, it can contribute to psychogenic dysfunction. If someone becomes accustomed to specific types of stimulation that don't happen in real intimacy, it can make real life arousal harder. The key is to be mindful, vary your stimulation, and don't rely on one type of sexual experience. So how do you improve erections naturally? Start by addressing underlying health issues like diabetes, high blood pressure, or cholesterol. Exercise regularly. Studies show that moderate aerobic activity 3 to 5 times per week significantly improves erectile function. Exercise enhances nitric oxide production, improves blood flow, and boosts testosterone. Sleep is another powerful tool. Getting at least 7 hours of quality sleep supports testosterone production, cognitive clarity, and mood, all of which affects sexual performance. Diet is also crucial. Research shows that men who follow a Mediterranean-style diet, rich in fruits, vegetables, whole grains, legumes, fish, olive oil, and nuts, have a much lower risk of erectile dysfunction. This holds true across all ages, even into the 70s. The diet helps reduce inflammation and supports vascular health. Specific foods like dark chocolate, apples, citrus fruits, tea, and kale, which are high in flavonoids, have also been linked to better erectile function. Omega-3 fatty acids from fish or supplements help increase nitric oxide availability, and watermelon contains citrulline, which converts into arginine, a precursor to nitric oxide. In summary, improving erections comes down to maintaining a healthy lifestyle. Exercise regularly, eat whole natural foods, maintain a healthy weight, sleep well, quit smoking, and avoid excessive alcohol or drugs. Treat your medical conditions early and stay proactive about your health, because erectile dysfunction is often a signal from your body that something deeper needs attention. Thank you so much for listening. If you found this information helpful, share it with friends or family who might benefit. Let's keep spreading awareness and helping people take better care of their health. And remember, take care of yourself because you're worth it.